name is Balog, and I'd like to thank the organizers for allowing me to present today. I have no conflict of interest. Pelvic organ prolapse is a quality of life disorder that affects many women. It is a downward descent of one or more pelvic organs causing discomfort. The primary risk factor is vaginal delivery. During pregnancy, the pelvic floor undergoes extensive remodeling, and elastin homeostasis can be disrupted postpartum. Current treatments include pessaries and surgical mesh are still accepted, but there are no current regenerative treatments. In our lab, we use a Lysyl loxodase-like 1 or Loxo-1 knockout mouse to investigate pelvic organ prolapse. It has a similar pattern to human pelvic organ prolapse. And here you can see a grade 0 with no prolapse, then a grade 1 with some prolapse, this bulge right here, then getting worse with a grade 2, and further with a grade 3. Additionally, in these mice, we can see elastic clumps, suggesting the elastin matrix having problems to regenerate. We can see an increase in Loxo-1 knockout mice, and then with prolapse Loxo-1 knockout mice, we see a further increase in these elastic clumps. One possible treatment option for pelvic organ prolapse is the use of nanoparticles. One PGLA nanoparticle has been shown to be effective in delivering elastin matrix regenerative factors and has been shown to have a low toxicity. So the aim of the study was to assess if nanoparticles implanted with mesh into the Loxo-like 1 knockout mouse model would remain in the pelvic floor and improve elastic matrix in the vaginal wall. Our experimental design was we had prolapsed animals that we implanted with mesh and then received vehicle or PBS treatment. Then we had prolapsed animals that received mesh and also received nanoparticles. The animals were then ex vivo imaged at 1 hour, 1 day, 2 days, 4 days, 7 days, and one group was then euthanized, and then the heart, lung, and liver, spleen, kidney, and the rectum, vagina, and urethral complex was harvested and ex vivo imaged. There was an additional set that was then also imaged at 21 and 42 days, and then at 42 days the tissues were harvested and ex vivo imaged. We had a control group for histology. This group were control animals that had prolapse but did not receive any mesh implantation, and they were harvested so that they were age matched with the 42-day group. Here you can see for the mesh implantation, we made a small incision between the vagina and rectum. We then created that space by gently opening the scissors and then placing a small piece of mesh into that area, and then while holding it closed, we then used liquid suture to join the two pieces of skin, and then the animal was allowed to recover and received pain meds. Here you can see example images. So here is before implantation, our PBS or vehicle compared to our nanoparticles in a microcentrifuge tube. After 1 day after injection and implantation of the mesh, you can see compared to the vehicle animal, there's an increase in fluorescence detected at the surgical site where the nanoparticles were placed in. You can see this at 7, you can see some at 21 days, and as well all the way out to 42 days. The analysis of this data showed a significant increase in fluorescence at 1 hour, 1 day, 2 days, 4 days, and 7 days with nanoparticle treatment compared to the saline or vehicle. But we did not see a significant increase at 21 or 42 days. Here you can see example, ex vivo organ images of the heart, lung, liver, spleen, and kidney, we did not see a difference between the heart of the control animals compared to the ones that received nanoparticles. But when you look at the rectovaginal urethral complex, we do see a significant increase in fluorescence in the nanoparticle treated animals compared to the control at 7 days. Additionally, we see a similar trend at the 42 days with an increase in fluorescence in the nanoparticle treatment in the rectovaginal urethral complex. The analysis of this showed that the heart, liver, lung, spleen, and kidneys were not significantly different from their time point controls. But when we look at the rectovaginal complex, we see a significant increase at nanoparticle treated animals at 7 days as well as 42 days. We then imaged the sections and saw an increase in fluorescence in the nanoparticle treated animals around the mesh at the 7 days and some increased fluorescence at the 42 days. We then looked at elastin in those sections, and we saw in the control animals we had the clumping of the elastin as we previously seen. With the mesh implantation, we additionally still saw clumping, and then with the mesh plus nanoparticles, we didn't see this clumping in our samples. So the nanoparticles resided in the pelvic floor, which would result in a long-lasting release of treatment. And then we also saw the nanoparticles improved elastin morphology. Future studies could look at how long those nanoparticles remain in the pelvic floor. Thank you for your time, and if you have any questions, please contact Dr. Margot Damaser.